Okay, now we're going to go through the last portion of our assessment, and this includes the palpation portion of the abdominal examination. We're going to go through 3 different types of phases of palpation, the light, the moderate, and then the deep. So when we start with the light palpation, we're going to go ahead and assess all 9 quadrants using a different mapping method where it divides all the quadrants into 9 different areas. And we're going to go ahead and push down no more than 1 centimeter deep, and we're going to lightly palpate all 9 areas to make sure that we don't find any tenderness, rigidity anywhere. Just as so. And then if we were to find something or an area that is tender to the patient, we'd go ahead and leave that last to palpate just for their own comfort. Then we would go ahead and continue with the moderate palpation, which is just the same circular soft motion that we were using before, but just a little bit deeper. We'd be assessing all these areas, always keeping in mind the anatomy and where things are located. Now, since we're pushing a little bit harder, you may find that some areas do have tenderness now that you palpate a little bit deeper. Now, we're going to go ahead and palpate with the side of our hand here. And what we're doing is we're trying to feel for the liver, which comes down a little bit lower on the right side, a little bit below the costral margin. And then we're going to palpate here on the other side for the spleen. Now, the spleen shouldn't normally be able to be touched. If you do, it may be due to possible splenomegaly, or possible inflammation of the spleen. So it's normal not to be able to feel it here. In order to feel the liver a little bit better, we can go ahead and ask the patient as we bear down here to go ahead and take a deep breath in. When he takes a deep breath in, we can feel the liver push up onto our fingers, and then when he releases the air, then it goes back to its normal position. But every time he breathes in, all the organs come down because the diaphragm presses down on them. So that's a way to be able to feel the liver. Gallbladder, you shouldn't really feel that. It's right below this portion of the liver here on the right side. In a healthy gallbladder, you should not be able to feel it. If you do, it could be indicative of something like cholecystitis. Okay, so moving forward, we're going to go ahead and now perform deep palpation. Now with this palpation, it is a lot deeper than what we were doing before. And we would go ahead and really press down, and now we're trying to actually feel the different organs, understanding that in each quadrant we do see different things. In particular, we're going to feel for the liver, the gallbladder again, the spleen, the kidneys, the aorta, and the bladder. So keep in mind where all those things are at. Now, while we're doing this, okay, so we're going to go ahead and go through with the deep palpation. Okay, and sometimes, okay, if the patient is obese or he's very muscular, you will have to use 2 hands to kind of visualize where everything is at. And you can press here below the costral margins, also trying to feel for the liver, possible spleen, and then you can feel the intestines, including the large one that comes across and back down here. Okay, so if you were to actually feel a mass, okay, you'd also want to document where its location is, the consistency of it, if it's able to be moved, its motility, and how tender it is in the area for the patient. Just being able to describe exactly what it looks or what it feels like. Lastly, we want to come around and just check the umbilicus side, making sure that it's not curving any other way or protruding or bulging, as this can be indicative of a possible hernia. So we're going to go ahead and start with the liver, and like I said before, it lies on the right costal margin, so we're going to again push in and ask the patient to breathe in, and then go ahead and breathe out. And the way that you can tell is that this area here with this portion of the liver is, it has a sharp angle, but it should be smooth. You shouldn't feel any nodules there. The gallbladder, like I said before, it's lying right underneath this lobe of the liver. You shouldn't be able to feel that either. The spleen lies on the left side, actually a little bit above the costal margin. It lies in the rib cage. You should not be able to feel that unless there's inflammation. And then the kidneys have a particular technique that you use. For example, if I am trying to palpate the right kidney, I'm going to put my arm on the flank of this patient, my left one, and then with the right one I would palpate pretty deeply to try to feel that kidney, and I should be able to feel it in between my fingers. So I would ask him to go ahead and breathe in, I would lift his flank, and I would press tightly to try to feel for that kidney, and then let him bring out the air. Now don't be surprised if the left side you don't get to feel very well, because the right kidney always drops a little further than the left. So you should be able to feel the right one a little bit better than the left. Okay, now the aorta could be felt. Now you can put your hand a little bit left of the midline and press down real hard. You can actually feel the pulse. In some cases, you can try to decide whether you can feel the pulse going sideways or not, and that could be indicative of an aneurysm. Now the bladder, lastly, right above the symphysis pubic area. You can go ahead and palpate that. You won't be able to feel that unless it's distended. Since this individual just voided, you will not be able to feel that here, but in other cases you would. And it should be smooth, round. You shouldn't feel any masses on it when you feel that. In patients, because I know we get a lot of patients that have hepatic failure, in a lot of those cases you see them have overall edema, especially ascites, a lot of fluid buildup in the abdominal cavity. In these cases, in order to be able to diagnose this ascites, you could use percussion again, especially when the patient's lying supine. Most of the water just goes distally here. So if the water is distal, you would hear more dull sound around the edges, and right in the middle you would find a more high-pitched tympanic type of sound. So you would palpate all the way around for dullness, right? And then you would come to the center, and you should be able to hear a more high-pitched sound, tympanic sound. Another thing that you could do, you could ask the patient to go ahead and turn themselves to one side, and gravity would actually pull the water in a patient with ascites down this way to whichever way he turned, and you could again palpate for dullness in that area, and then up higher it should be a higher pitched sound, a more tympanic sound in that case. Now there's a lot of different ways, different techniques people use. Okay, come back on your back. Also, when they state that they're thinking that the patient might have something like appendicitis, there are different ways that they have developed in order to diagnose this or assess it further. For example, there's one particular technique where at a 90-degree angle you press in with the fingers like this on the right lower quadrant where the appendix sits, and then remove it. And if the patient has pain, you may say that he does have possibly the appendicitis. Another thing is you can grab his right leg and then bring it forward and then move it around like this. And if the patient has pain, then you can state that he possibly does have appendicitis. Now, let me go back a bit because I forgot to recall one thing. So, again, going back, when you're assessing the abdomen and you're palpating, if you feel any masses, you want to be able to decipher whether this is a superficial mass or it lies intra-abdominally. The way to be able to be able to see that or palpate it is you ask the patient to lift his head up from the pillow, and then you palpate. Okay, if you're able to visualize the mass or feel the mass when he goes ahead and lifts his head up, that would indicate it's superficial. Okay. However, if it's intra-abdominal and he picks up his head and we don't feel it, we don't see it, then possibly this is something that's intra-abdominal. Okay, go ahead and put your head down. So this concludes the end of the abdominal assessment. Please tune in on the next videos. Thank you.